Healthcare is like any other service, just like plumbing, just like accounting or investment advice. If there's a lot of demand and there's not enough supply, the price is going to go up. The key to healthcare is to bring up supply and reduce demand. And how do we do that? We've got to make the consumer more involved in the healthcare decision. We've got to take it away from the bureaucrats and the big insurance companies. Get the personal involvement of the consumer. Health savings accounts obviously are a step in the right direction. Eliminating the tax deduction for corporations and for businesses so that individuals shop and purchase their own insurance. The other thing we have to do is increase supply. There's got to be more doctors, more nurses, more insurance companies, more hospitals. You know, McDonald's can't charge $20 for a hamburger because the Burger King is going to open up right next door to them and charge a lot less. Yet hospitals get to charge $2,000 a day because they can, because they get to tell other hospitals they can't move into their area, or that clinics can't do the things that hospitals do. So if you want to reduce the cost of healthcare and make it more available and affordable, what you've got to do is increase that supply to a point. How do you do that? More medical schools. You've got to break down the barriers that prevent medical schools from being able to be accredited. You've got to break down the barriers that prevent nurses from doing a lot of medical functions, like taking out stitches or prescribing, swabbing for a sore throat or something like that. Doctor doesn't have to be involved in those kinds of things. We've got to get more tort reform. We've got to stop chasing doctors away from the business. That'll increase supply. I'm a CPA who's represented doctors, and doctors keep telling their kids, go to law school. I guess that falls under the heading of if you can't beat them, join them. But the issue there is if we get more doctors, and doctors aren't run out of business by the tort lawyers, we'll have more supply. The other thing is that no doctor wants to work for the government. They don't want to be told how to practice medicine. And the clients that I have tell their kids, don't go into medicine because you're going to end up being employed by the government. So just the very fact that you've got the government out there, you got Hillary out there proposing that doctors are getting paid by the government means that that's a disincentive to people actually going into the medical field. And the other thing that is so essential to bringing down demand is prevention. And of course, the government can't force people to take better care of themselves. But you know how you do that? Economic incentives. Obviously, if you're footing the bill for your health care, you're going to be more circumspect about smoking or getting fat or not exercising and things like that. So government can only go so far. What we need to do is reintroduce consumer choices and consumer penalties, if you will, financial penalties for unhealthy behavior. And I think that's the best way that we can prevent healthcare problems in the future. On prescription drugs, my wife has rheumatoid arthritis, and she takes something called Humira, which is a wonder drug, but it's $700 a dose. And why is it $700 a dose? Because Canada, Britain, Germany, Japan, all these developed countries who use those drugs put price controls. Who ends up paying the freight? The American consumer, because we don't have price controls here. And that's a good thing, because you need companies to be able to make a profit in order to be able to research and to discover these drugs. So on prescription drugs, what we need to do is we need to obviously tort reform, junk science, get rid of that, and put a more balanced tort system. Loser pays. We need to streamline the FDA. It shouldn't take 12 years to get the approval of a drug. And we're killing terminally ill patients because they can't get access to experimental drugs. And so within limits, obviously, there has to be a streamlined process. And I think we have to use our trade power around the world to try to get other countries to stop putting price controls on our pharmaceuticals. Shifting the cost to the government, like what we did with the prescription drug benefit, doesn't make pharmaceuticals less expensive. It just shifts the payer. And what we need to do is have an intelligent view of this and go after the reasons why those drugs cost so much.